Hello everybody, welcome to another video. Today we are going to talk about a very important subject because it is very common and bothers people a lot, which is fever blisters. We will discuss the causes and treatments for fever blisters. But first, I would like to remind you that our channel brings important information about various health issues. So if you are interested in these issues, be sure to subscribe, and if you like our video, also be sure to like it, okay? So come on, cold sores are caused by the Herpes Simplex virus, and it is different from shingles, which is a different disease, because the virus that causes shingles is another virus, which although they are from the same family, are different viruses, and produce different skin lesions. The consequences are also quite different, so today we will focus on talking about herpes simplex lip. Fever blisters usually manifest themselves as small lumps with a liquid content. We call them vesicles. These vesicles usually cluster before these lesions appear near the lips. The person feels a tingling sensation, also feels a pain, and then the skin lesions appear. After a while, these vesicles break up with some crusts, and then heal over a few days. The fever blister usually gets better spontaneously, even if the person does not do any treatment, it tends to heal, but this is a characteristic of the herpes virus, because it stays lodged in our organism, in the nerve roots, so the person who has fever blisters presents these lesions, and after a few days the lesions heal, but at some point in the future they tend to appear again. And how does this happen? Well, first of all, the person has to get in contact with the virus, then a skin lesion caused by the virus appears. For this, the person has to be infected, and the most common way of transmission is by droplets, and most frequently, people get in contact with this virus still in their childhood, where they manifest the lesions on the labial mucosa. The lesion heals as we explained before, and the virus remains there dormant in the nerve roots, and in some circumstances that are usually associated with decreased immunity, there can be a more intense premature episode, or if the person has had another infection for another reason, or even prolonged sun exposure, can activate the virus, and it can return to make skin lesions. Then the lesions relapse. The intensity and frequency of this relapse varies a lot between people. So, a person who presents a simple herpes, what can he do to treat it? The first thing is to avoid squeezing, trying to rupture the vesicles or manipulating them, as this can sometimes even lead to an infection at the site and aggravate or hinder healing. Ultimately, if nothing is done, the episode will resolve itself over time. However, besides being bothersome both aesthetically and physically, the ideal is to treat it in order to alleviate all the discomfort caused by herpes. There are supplements with scientifically proven natural assets that can reduce the time of this manifestation. Usually the earlier the person starts taking the supplement, the better the effect will be. So currently the Herpesyl supplement has been highly recommended as a 100% natural supplement, which targets the real cause of your herpes outbreaks, and weakens and destroys the virus. In the description of this video, you will see a link that will take you to the Herpesyl website. There you can ask all your questions, and get this supplement to get rid of the herpes virus. It's worth checking it out when this video is over. It is worth remembering that adopting some habits can be fundamental to control the herpes virus, and we will talk about some of these recommendations. Some factors, such as trauma, stress, prolonged exposure to the sun, menstruation, favor the appearance of relapses. Try to control them as much as possible. In pregnancy, herpes simplex can be a concern. Inside the womb, the child is protected, but it can be infected during normal delivery, so keep your doctor informed. Always wash your hands, and avoid touching lesions, either your own or those of other people. See a doctor if you suspect you have the disease, which is not serious, but requires specific treatment. So guys, those are the tips and information from today's video. I hope you enjoyed the video. If this content helped you, please share the content, and of course, subscribe to our channel. This helps us a lot to keep growing. See you later.